Hi, and first off, thank you for your interest in our program. My name is Dr. Dave Seipert, and I am the Medical Director of our Ambulatory Medicine Clinic. I will be talking with you over the next 20 minutes about 1/3 of your curriculum, which is outpatient general medicine. So first off, I'd like to start with showing you some pictures of our facilities and also discuss the support we provide for both you and our patients. Pictured here is Riverside Community Medicine. This is your outpatient office. It is located right on Riverside Methodist Hospital's campus. Here is a bird's eye view of our medical campus. The medical education department is indicated by the yellow star in the middle of our map. I've also labeled our resident outpatient office towards the top right of the drawing, and this is where your outpatient ambulatory medicine experience occurs. As you can see, it is a short walk from the medical education department, and the parking lot directly adjacent to the building is where you park during your weeks with us at Community Medicine. Here are two pictures from inside our office. As you can see, Riverside Community Medicine was recently updated and our facilities are top-notch. Our main preceptor room is pictured on the left, and before COVID, our attending physicians and resident physicians would work side by side managing our patients. In the COVID era, we have spread out and utilize our nursing and medical assistant stations as pictured on the right. Here is our list of board-certified clinical faculty. Our team is made up of both general internists and subspecialty providers. So how do we support you in providing patient care? Well, again, we have 7 full-time general internal medicine physicians who provide care alongside you. We also are lucky enough to have 6 registered nurses who are really the backbone of continuity of care for our patients. As you can imagine, every year we graduate a group of residents, and our care coordinators know our patients better than anyone. Finally, we have medical assistants. They complete EKGs and other point-of-care blood and urine testing for you before your office encounters. So how do we support your patients? Well, we are fortunate at Riverside Community Medicine to have multiple on-site services. As you can see, we have a pharmacy with prescription drug assistance. We have an on-site lab so your patient can have their blood and urine testing completed before they leave the office. We have on-site financial assistance. We have an on-site social worker. And we also have an on-site scheduler, so many of your patients' appointments and tests are scheduled before they leave. We also are able to send our patients to the nearby Bing Cancer Center, which is a short walk from the office, for a lot of basic imaging. Let's transition and talk about your outpatient schedule. We follow an ambulatory care team model. We have 3 color teams as listed below. Our residents are equally divided amongst these color teams, and at any given time, 1/3 of your color team is with us in the primary care office. The rest of your team is covering the inpatient hospital wards. This separates our inpatient and outpatient curriculums and allows you to focus strictly on ambulatory medicine when you are with us in the office, and subsequently focus on your inpatient medical duties when you are assigned those rotations. Each team has an assigned nurse care coordinator, a medical assistant, and 2 attending physicians who work together to provide patient care. So here's an example of what your weekly schedule will look like. Listed below are 3 ambulatory templates, each assigned to a color team. Every 17 weeks, or each third of the year, your template will change. This ensures you have a variety of experiences and are exposed to all of our subspecialty clinics and education half days. If you look at Schedule Template 2 assigned to the yellow team, you can see that each week is made up of continuity clinics, administrative time, specialty clinics such as Hem/Onc clinic on Wednesday morning, and pulmonary clinic on Thursday afternoon, and education half-days such as geriatrics on Thursday morning. I'll give you a moment to look through the rest of the schedule. So after seeing an overview of your schedule, let's talk about each assignment in more detail, starting with continuity clinics. This is your private office hours where you provide longitudinal care to a cohort of patients. The ACGME mandates that you must have 130 half-day continuity clinics over your 3 years in training to graduate. Our program offers 4 half-day continuity clinics per resident per week. Your patient slots are made up of new, established, and also same-day appointments for your patients. The number of appointment slots increase as you progress through training. For example, as a PGY1, at the beginning of the year, you will see 3 patients per half day. Our PGY3s, during their first half of the year, are seeing 5 patients in a half day. You will manage your own cohort of patients, but you will also see your team members' patients for any active problems or close follow-up. Again, this allows you to focus on outpatient medicine when you're with us in the clinic, and then focus on inpatient medicine when you are assigned to the hospital wards. We are lucky to be able to provide a staffing ratio of 1 attending physician for 3 residents. This is an optimal ratio for us that allows us to provide great patient care and also provide education to you for each of your patients. Now let's discuss our specialty clinic assignments. This is a very important part of Riverside Community Medicine. This is how our residents provide specialty care to their patients who are usually underserved in these areas. It is very difficult to find specialty care for patients with limited or no insurance. At Riverside Community Medicine, we provide hematology oncology, endocrinology, rheumatology, gerontology, gastroenterology, pulmonary, allergy and immunology, and behavioral medicine clinic support for our patient population. Also at Riverside Community Medicine, we have a general surgery resident clinic and a dermatology resident clinic run by those prospective residency programs. All of these services are accessible for our patients. Next, let's talk about administrative time. You will have 3 to 4 half-day administrative assignments per week. This is dedicated time set aside during your schedule to work together in a color team to provide support and complete tasks that are a vital part of providing general internal medicine. You will work together to complete tasks such as refill requests, patient messages, calling patients about labs and imaging results, and also completing a variety of other electronic and paper in-basket requests. Residents also use this time for note completion and independent study time. This is also a popular time for you to schedule meetings with your faculty, mentors, and advisors. So moving on to the education part of your ambulatory curriculum. Your education begins as soon as you get here. During your first 2 weeks with us in the outpatient office, we provide you with intern orientation. This allows you to become familiar with our staff, learn the expectations that we have for you in providing patient care, and also spend time in the outpatient EMR. The inpatient and outpatient EMR are the same, however, the interface looks very different. We also put you through outpatient examination and procedure simulations to bring you back up to speed on a lot of the common exams and procedures we perform in the office. Finally, we review some of our high-risk medications through patient safety worksheets. These include both opiates and anticoagulants. Built into your schedule are 3 half-day didactic experiences. These experiences, again, are in rheumatology, endocrinology, and gerontology. They are led by Dr. George, our rheumatologist, Dr. Cottrell, our endocrinologist, and Dr. Rangaswamy, our geriatrician. We call them half-day didactics, but they're actually 2-hour education sessions, as documented below. Here is a list of some of the topics that you'll cover, with an emphasis on board preparation. Separate from those 2-hour experiences is our general medicine curriculum. This occurs on both Thursday mornings and Thursday afternoons. This curriculum is provided by all of our outpatient faculty, and again, run from 7:15 to 8 a.m. and 12:15 to 1 p.m. As you can see, we try to use a variety of teaching styles outside of just the PowerPoint presentation. Listed on the right of the slide are some of the topics that we are covering this year. They include billing and coding, vaccines, colon cancer screening, sexually transmitted infections, and controlled substance prescribing, just to name a few. Our Thursday afternoon didactics are based off of the Yale Ambulatory curriculum and Johns Hopkins modules. We have divided these modules into a 2-part lecture series. During the first Thursday, you will take a pretest to gauge the group's baseline knowledge of the topic. The topic will be introduced, and then you will be given a reading case assignment. We feel it is very important to start figuring out when in your life you will read medical literature for continual independent reading and learning as you progress through the program. During the second session, you will take a post-test so we can ensure you learn the objectives of the assignment. We will then review the topic and discuss the case presentation. Of course, your feedback of the lesson is also an important part of the second session. As you can see on the right, we have listed some sample topics that we plan to cover this academic year. Moving on to the next part of the discussion, which is feedback and evaluations. So feedback is a very important part of your learning. So we focus on giving you both formative feedback and a summative evaluation of your rotation. Formative feedback or coaching is small bits of information from observed activities in a timely fashion. After each patient encounter, we try to give you little nuggets of information to help you improve. We also perform direct observable activities. We are lucky to have one of our rooms at the office with complete audio and visual capabilities. We can observe and record the patient encounter for you to watch after you're finished. This allows you to see what you did well and areas where you can improve. Our summative evaluations or rotation evaluations are completed in new innovations. These are based off of the time of year in training and your PGY-1 level. We also provide you with 360 evaluations. These are evaluations and feedback from the entire care team, including the medical assistants and the nurse care coordinators. It is also very important for you to give us feedback. So twice a year, you will complete an anonymous evaluation of not only our faculty, but also our staff. We continue to strive for improvement, and feedback is an important part of a physician's training. We can also give you feedback directed specifically at the patient care you provide through performance audits. New this year, OhioHealth has given us the ability to review resident scorecards about the quality care you provide. This allows us to assess our practice and also drive improvement in patient care. For example, in the fall, you may sit down and see that you have a care gap in the number of patients that you have screened for breast cancer. You will come up with a plan to close this gap, and then in the spring, sit back down with your faculty member to see if your plan worked. If it doesn't work, no big deal. We go back to the drawing board and try to figure out what we can do better to make sure we are meeting a lot of our important quality metrics. Another avenue for resident feedback is through our Ambulatory Shared Governance Committee. Our Ambulatory Shared Governance Committee is chaired by Dr. Nick Mazenko. This is a multidisciplinary team made up of residents, attending physicians, medical assistants, nurse care coordinators, office administrators, social workers, and our practice manager. This is an opportunity for you to bring issues amongst the entire office and discuss how we can work together to improve our daily workflow in the patient care we provide. To the right are some current projects we are working on together. Lastly, I'd like to highlight our primary care track. So our primary care track is directed by Dr. Nick Mazenko and supported by Dr. Chris Barlow. This is in a way for our residents who are interested in primary care to focus their PGY2 and PGY3 years on outpatient general medicine and the subspecialties. This track is offered to 2 interested medicine residents per year. These residents get exposure to a private practice office in our community. This allows them to see what providing general internal medicine is like outside of a resident office. We collaborate a lot with our family medicine residency as well. They help us provide experiences in osteopathic manipulative therapy and also ultrasound-guided joint injections through their board-certified sports medicine physician. It is with these 2 physicians and their private practice groups that our primary care track residents spend time with during their PGY2 and PGY3 years. Dr. Matt Skomorowski and Dr. Bill Schnackle are both prior graduates of our program. They are fully invested in your education and enthusiastic about providing general internal medicine to our patients in Central Ohio. Here is a look at our primary care track residents currently in the program. If you get a chance to interact with any of these residents during your interview day and you are interested in primary care, please talk with them about their experience. Finally, I want to take a moment before we conclude to recognize some of our prior graduates. These individuals were all recipients of the Ambulatory Medicine Resident of the Year Award. This award is voted on by all of our faculty and staff here at Riverside Community Medicine. Why I think this slide is important is to point out that not one of these 3 individuals pursued a career in primary care. However, they were all engaged and provided tremendous outpatient medicine. Our residents here at Riverside are engaged in both inpatient and outpatient medicine and truly enjoy their experience in both settings. That concludes my part of the presentation. I hope you were able to gain some insight and information about the outpatient part of our curriculum. Thank you again for your interest in OhioHealth Riverside Methodist Hospital's internal medicine residency program, and I look forward to having a more in-depth conversation with each one of you during your interview day.